and
Uh,
they told
yeah.
me to restart. So
Okay. Yeah.
so my screen is
Yeah.
shared.
No, it's not. It was
Yeah.
shared earlier for 1 second, but then it stopped.
Uh,
Yeah. Now it's just appearing. Yes. Yes. Now it's there. Yeah.
yeah.
Yes.
Okay. So, thank you for inviting me. Just a small talk about simple bone health for elderly or senior citizens. I am Dr. Rohan Bhiwgade. I am mainly a joint replacement surgeon and sports medicine surgeon practicing in Navi Mumbai since the last 15 years. And my main interest is joints, be it young patients for ligament injuries, being old patients for joint arthritis and replacement. So today I'll be speaking on oh,
Yeah.
yeah,
Yeah.
yes. So I'll be speaking on our bone health. So as you know, bone is a living tissue like heart, lung, liver, kidney. It is mainly made up of collagen and calcium, and more than 99% of our body's calcium is deposited in bones and our teeth, and remaining very small amount is in our blood. So why bone health is important? Bone supports our body, facilitates movement, it protects our major organs like brain, heart, and all, and it is important for our strength also. So what affects bone health? The main thing is our diet. A diet low in calcium contributes to diminished bone density. That has a risk for early increased risk for fractures also. Physical activity is one of the factors which we regularly see in our younger population. More of sedentary lifestyle and inactivity can cause a higher risk of osteoporosis compared to active people. Again, one thing which is mainly because of lifestyle is smoking and alcohol intake. Smoking is a risk factor for bone loss and fracture, as well as alcohol. It affects our bone development and maintenance at all ages. uh, Also, women are at a higher risk of osteoporosis than men, mainly due to the hormones and menopause at a later stage. And people who have a very low BMI, who are very thin or very obese, they also tend to have osteoporosis because they have less bone mass compared to their weight. Age again is an important factor. After mid 30s, you start losing bone mass. Women lose more bone mass and fast due to menopause. It also happens in men's. We recommend starting osteoporotic treatment after 45 in female and after 55 in male to all in general population. Bones can weaken early in life without a healthy diet and right kind of physical activities. Meaning, it is not just at a later stage or old age that we have decreased bone density. If from a very younger age, if the health diet is bad or there are no physical activity, he can have a bad bone health also. So weak bones lead to what we call it as osteoporosis. Now there is a lot of confusion. What is osteoporosis? What is osteoarthritis? These are commonly termed used by doctors, but sometimes they are misleading what exactly they are. So osteoporosis, osteo meaning bone, porosis meaning it is porous inside. So the bone density or the bone matrix, the calcium content of the bone has reduced. So that we call it as osteoporosis. Now this osteoporosis can lead to osteoarthritis later age. Arthritis is wear and tear of a joint. So osteoarthritis is uh, later stage after osteoporosis. So with osteoporosis we can have fractures, we can have osteoarthritis also. But the good news is that we, for these all conditions, it can be prevented as well as treated. There are 5 steps that I would like to tell you. The first very easy step is to have a daily recommended amount of calcium and vitamin D. Vitamin D and calcium requirement varies with age. Calcium requirement is maximum at a adolescent age, and when during pregnancy, and at the old age. Vitamin D requirement increases with age. Minimum calcium requirement per day, we can say it as around minimum 800 to 1000 milligram, and with vitamin D dose that is required is 400 to 600 international units. So with age the requirement increases. From diet, the most important food that we can consume for calcium is dairy products, milk products. Even if you are lactose intolerant, they say that you should be taking some amount of milk products, dairy products, for to meet the calcium requirement. But sometimes obviously just having dairy products is not enough. We need fortified foods also. For example, in our common salt we have iodine to prevent to keep thyroid normal. Similarly, we have calcium and vitamin D fortified foods also. So just simple food is not enough. We need dairy products as well as fortified products. Secondly, we need regular weight bearing exercises. Exercises across the lifespan should be encouraged, be it young, be it old, to increase our peak bone mass and reduce age related bone loss. After a certain age, the bone mass and the bone density keeps reducing. So if our at a younger age, if our bone mass is low, at an older age it will be much more less than what is required. So we need to keep it intact. And an active person, there is almost 50% reduced chance of fractures compared to inactive person in an older population. Thirdly, avoid smoking and alcohol. Cigarette smoking is related to fractures, fracture healing, wound healing problems, as well as alcohol. Alcohol causes dysfunction in bone formation and calcium deposition in the bone as well. So avoid those. Talk to your doctor about your bone health. If you are suffering from joint pain, knee pain, back pain, and it is not going, ideally you should be visiting your doctor. uh, we can start treatment as soon as possible before the problem becomes big. We can start supplements, calcium and all. We can start physio and exercises. We can train for your posture, because of our sedentary lifestyle we are sitting more than walking. So while sitting also, the way you are sitting, the posture, that is also important. So those all can be done only if you speak with your doctor. And lastly, have a bone density test done, what we call it as a DEXA scan. Ideally after the age of 50, everyone should be doing bone density tests at least once a year or once in 2 years, to check how bad is the osteoporosis problem. Mainly because people who have osteoporosis are not diagnosed because they are not tested at all. That's why. So if the bone density, the DEXA that we do, and it shows very low bone density, the calcium content is very low, we have a lot of treatment options. The best treatment options these days we have are injectables. To increase the bone density, we have a daily injection, and to retain that bone density, we have a injection which can be given once in 6 months. Obviously, we have calcium supplements, vitamin D, and other medicines to increase, but the most potent treatment that we have are injectables these days. One myth that I would like to clarify is the sun exposure for vitamin D. You know, just like to add before that, vitamin D is required for calcium deposition in the bone. So it's like, though it's a vitamin, it acts like a hormone, and an important hormone for calcium density, or preventing osteoporosis. So vitamin D is manufactured in the skin when we get UV exposure from sunlight. We need afternoon sunlight, not the early morning. Ideally, we need 11 a.m. to 2 p.m. sun exposure for better vitamin D production in our body. Early sunlight and evening sunlight, it scatters the UV rays and we don't get too much. So clothing, sunscreen usage, tinted glasses, pollution, these all reduce the UV exposure and vitamin D production also. So just to conclude, our bone health, what we want is a good amount of calcium and vitamin D supplements, good amount of exercises, prevent falls in older age. We need more muscle and bone weight compared to our fat, and stop smoking and other injurious things. Thank you so much.